Canadians with low literacy skills will rise 25% by 2031, making that 15 million Canadian adults with poor reading skills. The report says Canada must put more adult education programs in place to address these issues in order to stay competitive in a global environment. While osteoporosis is often known as a silent disease because it often goes undetected until a bone breaks, researchers say 80% of fractures in people over 60 are related to osteoporosis, but a new medication is giving new hope to women who are living with that disease.
Iris Richmond knows what it's like to be diagnosed with osteoporosis and to learn how it could impact her quality of life.
When I was diagnosed with osteoporosis, I was absolutely shocked. Didn't think this could happen to me.
A 50-year-old woman has a 40% chance of developing hip, vertebral, or wrist fractures during her lifetime. Despite the availability of treatments, osteoporosis often remains undertreated, as challenges with currently available medications can include side effects and difficult-to-follow schedules.
Well, one of the major roadblocks of treating people with osteoporosis is actually getting them to adhere to their medication and take their medication according to what their physician prescribed. Some people simply don't follow the treatment schedule that they're supposed to be on. Some people have side effects from different types of medical options that they try to take. That's why it's very important to us at Osteoporosis Canada that patients have access to different treatment modalities so that they can find the one that's right for them.
Health Canada has recently approved Prolia, a new treatment for osteoporosis in postmenopausal women at high risk for fracture. Unlike existing therapies, Prolia is a targeted therapy that treats osteoporosis by blocking the rank ligands protein to stop the cells that break down bone. Dr. Aliya Khan, clinical professor of medicine at McMaster University, says
osteoporosis can be treated. We have a number of valuable treatment options which enable us to prevent fractures of the hip, the spine, and the forearm. Currently, we have many people who are not diagnosed and are not being treated for this common condition. Prolia is a new treatment for osteoporosis. It decreases the rate of bone loss, it increases bone density, and it can prevent fractures in people with osteoporosis. Prolia is given every 6 months as a simple shot by your doctor, and it prevents fractures.
I had a significant improvement while I was on Prolia, especially in my lumbar spine. Prolia has simplified my life in that it is so convenient, an injection twice a year.
As women age, bones shouldn't break without significant trauma. However, osteoporosis-related breaks among women are more common than heart attack, stroke, and breast cancer. Dr. Khan comments.
Women should know why osteoporosis develops and what steps they can take to prevent osteoporosis and fractures. This will enable them to live full, healthy lives without fractures and ensure that they have the best bone health possible.
Dr. Aliya Khan says regular physical activity, proper diet, and taking appropriate calcium and vitamin D are things that you can control and are important for overall bone health.
Dr. Khan says there are things that women can do to take care of their bones and help prevent osteoporosis. She recommends exercising, eating well, and taking calcium and vitamin D supplements. Well, at the other end of the spectrum, it is the news that pregnant women do not want to hear, especially if they have morning sickness. Experts say there is no evidence that any available treatments are safe and effective at reducing the vomiting and nausea that usually occurs in early pregnancy. The study even looked at alternative therapies like acupuncture. Well, there is little evidence to show that medications and supplements like